Good morning, and as you can see, we are doing safe distancing, social distancing, so we do encourage you to do the same. My name is Elizabeth Long. I'm Media Relations Manager for Kettering Health Network. And I'd like to introduce the Kettering Health Network leaders who will be speaking today. Dr. Jeffrey Weinstein, he's an infectious disease specialist with Kettering Health Network. Brenda Kuhn, she's the Chief Clinical Officer at Kettering Health Network. Also with us to answer questions is Dr. Patrick Lytle, who's Vice President of Clinical Outcomes for Kettering Health Network, and Tim Dutton, who's Chief Human Resources Officer for Kettering Health Network. After everyone speaks, I will invite members of the media to ask questions. So first, I'd like to introduce Dr. Jeffrey Weinstein, infectious disease specialist, who will discuss our first COVID-19 patient.
Thank you, Liz. As you know, yesterday we announced that a patient tested positive for COVID-19 at Kettering Medical Center. The patient was a male in his early 60s from Montgomery County. He was taken to Kettering Medical Center on Saturday, March 14th, where providers met him outside the emergency department, placed him in a mask, and escorted him directly into a private room to avoid exposure to anyone in the emergency department. He was admitted to a private room for one night, and he was then discharged home on Sunday, March 15th, in good condition with instructions to self-isolate at home. We have spoken to the patient, and he is doing well. In order to protect patient privacy, no other details will be provided. The patient was tested for COVID-19 while he was in the hospital. The result came back positive on Wednesday, March 18th. Our physicians, nurses, caregivers, and staff all took appropriate precautions to protect all patients and staff in accordance with U.S. Centers for Disease Control and Prevention guidelines. Thank you.
Thank you, Dr. Weinstein. Now I'd like to introduce Brenda Kuhn, who again is Kettering Health Network's Chief Clinical Officer. She's going to talk about Kettering Health Network's response to the COVID-19 outbreak.
Thank you, Liz. Thank you for joining us this morning. First, I want to emphasize that COVID-19 is a community spread disease that can affect everyone, no matter your age. It's no longer a disease spread by people who have traveled abroad. The leadership, physicians, nurses, and staff at Kettering Health Network know this is a stressful and challenging time for our community. We are mobilizing resources to care for and protect our community, caregivers, and patients. We are doing this with other partners in our community together. We are working around the clock to care for patients in our hospitals and outpatient facilities. We are still providing the same quality and compassionate care that people have come to expect from Kettering Health Network. Kettering Health Network established a network incident command center 2 weeks ago. It is now operational 7 days a week, and it has gone to 24 hours a day. The purpose of the network incident command center is to allow us as a network to manage patients, their needs, and our network resources. Incident Command is responsible to create policies and practices to address situations that are different from normal operations evolving from the pandemic. Some examples of this include limiting our visitor policy, developing screening points, creating shared governance groups to evaluate elective surgeries, and many other processes. Some of those are internal for our employees, and some of those will be seen as impacting the public. I'm going to first talk about testing. Thus far, we have tested 73 people for COVID-19. One test has come back positive. 31 have come back negative, and the others we're still waiting on results for. We have testing kits at our hospital for those that meet CDC testing requirements and that need to be admitted because of their symptoms. Community testing sites have been set up for patients who meet CDC requirements. You do need a physician's order if you're going to one of the community testing centers. We want to continue to remind people about what to do if you're sick. If you don't feel well, please stay home and self-quarantine. If you have a fever and a dry cough, self-quarantine and call your doctor. If you have shortness of breath and can't take care of yourself, please seek medical care. Please call ahead to the physician office, the urgent care facilities, or hospitals so they know you are coming. If you have questions about COVID-19 and any symptoms you may be experiencing, call the Ohio Department of Health hotline. That number is 833-427-5634. I'm going to walk through a couple of specific changes that we've made that will be impactful. First, elective surgeries. As you may know, Governor DeWine declared that all elective procedures should not be performed after close of business yesterday. We are complying with that order. State mandated criteria for the procedures will be if it's a threat to the patient's life, if surgery is not performed. The second criteria is a threat of permanent dysfunction of an extremity or organ. The third criteria is risk associated with a cancer diagnosis. And the fourth criteria is rapidly worsening to severe symptoms. We are having a daily review of each surgery that's being performed here to make sure we are compliant with the governor's declaration. The reason for doing this is to limit personal protective equipment so that we can use this as the pandemic evolves. Second, I want to talk about visitor restrictions. A reminder that we have visitor restrictions that have been implemented in all hospitals and outpatient areas in conjunction with our community agencies. We've done this to protect our patients, our employees, and our community, and to limit the community spread of COVID-19. We are screening all visitors at each of our entrances. I want to move on to our employees. I want to mention how we're helping our employees and caregivers who have unique needs during this outbreak. We have established policies and protocols for staff who work with patients of any infectious disease, and we have modified those to meet the needs for COVID-19. While we train and hold exercises on a regular basis, we have provided additional education and training for the highest risk employees on their personal protective equipment. Many of our employees who are not essential to patient care have the ability to work from home to support the call for social distancing to help reduce the spread of COVID-19. I want to talk about daycare a minute for our employees. Some members of the media have asked us about how we're taking care of our employees with daycare. We recognize that the recent school closures may place an extra burden on our caregivers and our other support staff. To help give them peace of mind and enable them to work, Kettering Health Network is partnering with our local YMCA institutions to provide our child care resources for our employee families. We are so grateful for the support of the Grayton-Dayton YMCA for working closely and collaboratively, and I'm going to say quickly again, to bring resources to our healthcare team. Thank you.
Thank you, Brenda. We also want to thank you, the media, for helping us get essential information about COVID-19 to the public in a responsible manner. You're on the front lines too, and we recognize your importance in this initiative to help people be informed about healthcare's response to COVID-19. With this, are there any questions?
Can you talk a little bit about how we're making sure that these potential COVID-19 patients aren't being exposed to others, medical staff, or maybe others who, waiting area, things like that?
Dr. Weinstein?
Thank you very much. So we are following all of the CDC's guidelines in terms of infection prevention and control. So that would include personal protective equipment for all of our caregivers. Typically, that entails wearing gown and gloves, of course, mask, and also eye protection for taking care of these patients. At the same time, any patient who is under suspicion for this COVID-19 infection is placed in an isolation room. And even before the testing results come back, they are all treated as if they are potential cases of COVID-19.
You released this man, pretty quickly. Was it, what was it about it that made you think that was the safest, best way to handle it? And how do you ensure someone that has a positive test complies with self-isolation or quarantine?
Sure. So we're not going to give specifics about the individual patient. Guidance that comes from CDC and other groups is that if patients are recovering sufficiently to not need to be in the hospital any longer, they can be discharged to home, and public health authorities are alerted to them. The patients, of course, are told to self-isolate at home so that they do not expose others. And a variety of instructions are given to them, essentially by the health department, but we warn them as well.
Prior to quarantine, is there any fear or thought that maybe this person may expose others?
Again, we're not going to get into specifics with this patient. The health department has a role of what's called contact tracing, where they essentially interview patients who are diagnosed, and then they try to track who potentially might have been exposed. We know that at our healthcare facilities, as I mentioned, he was actually met outside of the building, a mask was put on, so we do not have exposures within Kettering Medical Center.
Can you just explain why it is better to have, once he's to that certain point where you feel that he's safe to go, why it's better to do that rather than keep him longer in the hospital?
Well, typically, there's a variety of answers to that question. Number one is when a patient is well enough, they should not stay in the hospital for many reasons, including the fact that hospital-acquired infections or other complications could occur. The other reason, of course, is we don't want our staff to continue to be exposed to a patient who is otherwise well enough to be at home.
We're hearing that Ohio hospitals as a whole are at about 75% capacity. Can you be more specific about Kettering Health Network?
Who would like to answer? Brenda?
So we are currently running at about 60% capacity. We have not seen a dramatic change in our census since this has started.
You said you were screening people at the entrance to all of your hospitals. What does that screening include?
It includes a questionnaire, and we're checking temperatures.
Are checking temperatures of all visitors coming in
Yes.
to each of your hospitals?
Yes.
Okay. What about, you mentioned that you've done 73 tests. Is that spread out over all your facilities at one facility? How is that work?
Those 73 tests have been spread out across our network.
And are these patients that you knew were coming in to be tested, or were tested after you started seeing them? How did, you know?
These are patients that come in that meet the requirements, and we believe most likely will need to be admitted, and so we do the testing.
If somebody's at home, how do they know if they meet those requirements and if they should self-quarantine or come see you guys?
Do you want to take that?
So we are recommending to people at home who might have symptoms of fever, cough, respiratory symptoms, shortness of breath, that they contact their healthcare provider. We do not want them, if they're well enough to be at home, generally we want people to stay at home. Remember that the large majority of patients who get infected with COVID-19 or have the disease have a mild illness, and they would not require hospitalization. For those who have symptoms compatible with the disease and their healthcare provider wishes for them to get tested, but they are not sick enough to come to the hospital, they would be directed to the testing centers that have been set up within the community outside of the hospitals.
Of those 73 tests, are some of those staff members that did work on the case of the one positive patient you had?
No, that is not the case. These are all patients who presented for their care.
Okay. And then I just have a couple supply questions. As far as tests, because I didn't know you were doing, them at the hospital. Do you have enough tests on hand at this point, or are you trying to get more? Where do you stand?
So we'll be clear. We are performing the swabs. We are not doing the testing on site. They are being either sent to the Ohio Department of Health or to an outside laboratory. We do have a good number of the testing swabs on hand, but as everyone knows, there has been a limitation throughout the country in terms of testing. It's improving day to day, as you've seen in the numbers, but it's taking several days for results to come back.
Can you give
question about supplies I had was about personal protective equipment. Where does the network stand in terms of that? I mean, are you comfortable with where you are right now? Who would you reach out to try to replenish those stocks?
We have multiple resources to answer the last part of the question. We have multiple resources from a stocking standpoint. We're in the same category as all facilities across the United States. Currently on hand, we're very well supplied, but as this disease continues to progress over the coming weeks and months, everybody's making contingency plans.
This is maybe a little offbeat, but there have been some people who contacted us once they kind of realized they were hoarding masks or whatever. Is there a way for someone that wanted to drop masks back off to a hospital, realize they themselves didn't need them, for someone to do that?
I am not aware of that. That would be something that we would probably, if it was coming from an unknown vendor or source, that would be something that we would want to make sure that they are not contaminated.
That's what I
Can you
Yeah.
be a little more specific as to what a good number of testing swabs means? What is that number?
I do not, all I can say is that we continually watch our supply and continuing to work with other facilities as well as the Ohio Department of Health to make sure that we have adequate supplies to take care of our sickest patients and to test the ones that are according to guidelines. Yes.
Just for the record, can we get your first name and your last name?
I'm Dr. Patrick Lytle. Yep.
Do you have an age range for those 73 that you tested?
We do not.
I do not. Do not.
As you go forward, are you having to change things on a pretty much daily basis, given instructions from Washington and Columbus?
Yes, we monitor both the CDC and the Ohio Department of Health on a daily basis, minute basis, and we also internally monitor our own processes so we can monitor our supplies, how we're taking care of our patients, and truly going through a bunch of contingency plans, which I pray that we never have to get to.
I just have one more about the elective surgeries. So that you have, do those guidelines come from hospital or state or combination on the guidelines? You listed like 4 categories that you were kind of continuing forward.
Those came from the Ohio Department of Health. Those were the regulations coming from the state, recommendations, and we're adhering to them.
Can you say more about it? You said community testing centers. How many of them are there and where are they located?
There's several in the Cincinnati market and one at University of Dayton. And Wright Pat is reserved, from what I understand, for defense employees only.
Will you be thinking about setting up tents outside many of your hospitals in case you we start getting a larger number of patients? Have you made those contingency plans? Talk about that a little bit.
We are looking at all those type of options, and they are part of our contingency plans. Thank you.
Are there any other questions? Okay, well, I'd like to thank you all for coming. And if we have any more updates to share with you, definitely we will let you know, and we will either reach out in the form of a press release or we'll be holding another press conference. Thank you.